Enhanced PPE donning and doffing sequence. PPE should be done using the buddy system. The buddy will read from the checklist, ensuring that each step is followed, and they will check off each item as you proceed. Wait for full instructions of each step before proceeding. Step 1 and Step 2. Check vitals and complete the contact log. Step 3. Get disposable scrubs and go to the designated room to change. Use the washroom and hydrate with water. Remove all jewelry. Tie back hair and don bouffant cap. Step 4. Boot covers. Sit on a stool and tuck your pant legs into your socks or secure with tape, and then put on the boot covers. Step 5. While still sitting on the stool, pull the coveralls on over your legs. Stand up and zip the coveralls up to your waist. Step 6. Cooling vest. Insert pre-cooled cooling packs into the cooling vest. Put the vest on and adjust to fit. Pull your coveralls completely on and zip up to just below your neck. Step 7. Gloves. Put on the first pair of extended cuff nitrile gloves and pull the arms of the coveralls over the glove cuffs. Your buddy will rip off pieces of wide masking tape and create a tab at one end. Stick the pieces of tape on the edge of the PPE cart in preparation for use. Your buddy will tape wrists with wide masking tape, ensuring half the tape is stuck to the cuff of the coverall and the other half to the glove. Press all tape interfaces to ensure they're sealed, and don't wrap too tight around wrists. If there are any rips or not enough tape to wrap, begin again with new tape. Do not try to add or reuse tape. Step 8. Put the N95 respirator on and perform seal check. Step 9. Put on a pair of safety glasses or goggles and use anti-fog wipes if needed. Step 10. Coverall hood. Your buddy will help pull the hood up to ensure all skin areas are covered and that your hair is tucked inside the hood. Your buddy will ensure the hood is zipped fully to the top and that the zipper is locked into place. Step 11. Gown. Put on a fluid-resistant gown. Your buddy will fasten the gown by sticking the Velcro fastener at the neck and tying only the outer tie of the gown with a bow. Next, your buddy will apply a piece of masking tape with a tab at one end over the tie of the gown. Step 12. Put on the face shield. Step 13. Inspect yourself in the mirror to ensure facial coverage. Step 14. Gloves. Put on a second pair of extended cuff nitrile gloves, extending over the cuff of the gown. Remember to choose one size larger than usual. Step 15. Your buddy will now check that all PPE has been applied correctly and that no skin is exposed. Step 16. Label 2 pieces of masking tape with your name, occupation, and the time that the PPE was applied. Apply tape to both the front and the back of the gown. Steps 17 and 18. Your buddy will date and sign the checklist and don the contact droplet PPE using a fluid-resistant surgical gown. Your buddy will wait in the clean area outside the treatment room to assist as required. Your buddy does not enter the patient's room. Doffing PPE sequence using the buddy system. Step 1. Communicate to your buddy that you wish to exit the patient's room and exit only when your buddy directs you to. Step 2. Exiting the patient's room. Pull a wipe out of the container and use it as a barrier in your hand to open the door to the doffing area. Drop the wipe in the biomedical waste receptacle. Step 3. Instruction. Each instruction will be read to you completely before you are allowed to proceed. This allows for close observation of each individual step to ensure contamination does not occur. Step 4. Pick up any previously doffed PPE from the floor and place it in the biomedical waste receptacle. Remove the blue pad covering the stool and place it in the biomedical waste receptacle. Step 5. Turn slowly 360 degrees so your buddy can determine any areas of contamination. Step 6. Wipe away gross contamination. Use wipes to remove gross contamination on gloves, gowns, and any other surface your buddy points out to you. Step 7. Gown. Gently pull tie with masking tape tab at the waist to untie the gown. While facing the waste receptacle, cross your arms and grab both shoulders of the gown and pull gently to the sides to release the Velcro closure at the back. Pull the gown down and remove it by rolling it down your arms and turning it inside out. Remove your outer pair of gloves at the same time inside the sleeve, and be careful not to contaminate the inner gloves. Directly drop the gown with gloves into the biomedical waste receptacle. Step 8. Face shield. Reaching to the back of your head, remove full face shield and directly drop into the biomedical waste receptacle. Step 9. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 10. Tape. Remove the tape at your wrists by gently pulling on the tab and discard into the biomedical waste receptacle. Step 11. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 12. Zipper of coverall. Using a mirror to guide you, undo the zipper of the coverall completely and be careful not to touch any other area but the zipper. Step 13. Hood of coverall. Gently pull off your hood by pinching each side near the temples and slowly roll it off the back of your head. Step 14. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 15. Stool cover. Your buddy will provide you with a new blue pad for you to drape over the stool. Step 16. Removing coveralls. Insert clean gloved hand into the opposite cuff of the coverall and pull the sleeve over the glove. Repeat with the other hand in mitt fashion. Slide the coverall below your knees while rolling inside out, touching only the inner surface of the coverall. Sit on the stool near the exit line. Remove coverall leg and boot cover. Place your foot on the inner surface of the coverall and repeat with the other leg. Stand up with your feet still on the inner surface of the coverall. Step 17. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 18. Remove the cooling vest. Undo the straps at the waist and 1 shoulder. Then slide the vest off your remaining shoulder into your hand and discard into the biomedical waste receptacle. Step 19. Remove inner gloves. Using the glove-to-glove, skin-to-skin, remove your gloves and discard in the biomedical waste receptacle. Step 20. Hand hygiene. Your buddy will dispense 2 to 3 pumps of hand sanitizer into your palm. Perform hand hygiene. Step 21. Eye protection. Remove your safety glasses or goggles and discard them into the biomedical waste receptacle. Step 22. Hand hygiene. Your buddy will dispense 2 to 3 pumps of hand sanitizer into your palm. Perform hand hygiene. Step 23. Remove N95 respirator and discard into the biomedical waste receptacle. Step 24. Hand hygiene. Your buddy will dispense 2 to 3 pumps of hand sanitizer into your palm. Perform hand hygiene. Step 25. Remove the bouffant cap and discard into the biomedical waste receptacle. Step 26. Hand hygiene. Your buddy will dispense 2 to 3 pumps of hand sanitizer into your palm. Perform hand hygiene. Step 27. Exiting the doffing area. Step off the inner part of the coverall, across the exit line, into the clean area of the floor. Step 28. Hand hygiene. Go to the designated sink and perform hand hygiene for 1 minute with soap and water. Wash up to your elbows. Step 29 and 30. Obtain post-vital signs. Complete the contact log, and your buddy will sign and date the checklist.